I want to thank you for clicking on this video link. For the next few minutes, we're going to tell you about this brain infection called encephalitis. And we're also going to talk about a new study we're doing to try and improve the outcome of this disease. Encephalitis is inflammation and swelling of the brain, most often caused by a virus, typically herpes simplex virus. You may know this virus, it's the one that causes cold sores, but sometimes, for reasons we don't understand, it goes up into the brain and causes inflammation and swelling here.
Patients usually affected very long term with encephalitis. Majority of the patients will have some memory problems in the future, can have personality changes, become very confused very easily, very fatigued.
We were really, really frightened, and I thought, is there anything that Cheryl could do, that we could get Cheryl involved with, that would help this horrible disease that she'd got, or this infection that she had.
The Encephalitis Society works in three main areas: support and information for patients and their family after encephalitis, raising awareness about the condition to improve understanding in people's communities and in the general public, and in research, which is part of what this trial is with the University of Liverpool.
Dexamethasone is a steroid medication which we think may help to reduce brain swelling in the condition, and we're hoping that this may improve outcome for patients.
Some doctors use it quite a lot, others don't use it at all, and we really need to know whether this drug can help improve the outcome in encephalitis.
When Cheryl was having the acyclovir treatment, the doctor asked if it would be possible to give Cheryl dexamethasone. I wasn't really sure what dexamethasone was at the time, but I agreed for Cheryl to have this. I felt that anything that could be given that the doctor said was good, that would help her, then I would agree to.
As a patient, I'm extremely pleased that I was able to take part in various studies about encephalitis, as we're the people that really know and are affected by encephalitis. And I think it's a tremendously positive thing to do once you've survived an illness like this, that we can go on and help other people in the future.
We're giving dexamethasone for 4 days. It's a very short course, and there are very few side effects associated with this drug, which has been used in many conditions for many years.
So the way that the study works is that all patients will receive the current standard of care. So they'll all receive supportive care, and they'll all receive acyclovir, which is the antiviral drug that we use in this kind of encephalitis. But half of the patients will also receive dexamethasone, and the other half won't. And hopefully this will help us to find out whether dexamethasone is a useful treatment or not.
We hope that you'll think seriously about being able to take part in this trial, and if you need more information, it's available from the hospital or from the Encephalitis Society staff team.
As someone with experience, I would really urge you to think about becoming part of this study. It's so critical to the development of new drugs which can help patients to recover.
Without trials of this nature, medical treatments don't move forward.
Please don't be afraid to get involved in research, because it is really important and it will help people in the future who have that condition.
Encephalitis, something you've probably never heard of until now. That's why this trial is so important, though, to help other families that may come after you.
I know it's a difficult time, but as I'm sure you appreciate, every drug we use in the hospital today is there because at some stage people have made the difficult decision to allow their relative to be studied so that we know which are the best drugs for all the conditions that we treat. Thanks very much.